Hello viewers and welcome to my channel. My name is Dr. DR.KOITATOI. I create this video to do an awareness on benign prostatic hyperplasia, BPH, and prostate cancer. Both conditions affect men because they affect the prostate, which is a gland beneath or below the urinary bladder. I start the video with two scriptures from Matthew chapter 26 verse 36 to 39 and John chapter 11 verse 35. These two scriptures talks about Jesus. When Jesus was about to be crucified, he identified with pain and sorrow, and that's what has been recorded in the Bible, that he prayed and noted that the situation was so much overwhelming to him. And in John chapter 11, it's recorded that he cried when he was told that his friend Lazarus is dead. So he identifies with pain, he identifies with sorrow, and he identifies with going through an overwhelming situation. It's not being ungodly when we report that we are in pain, or when we seek health care, or when we seek for help whenever we are going through a difficult situation. It's just being human. So we are expected to seek help even when we are in pain. It challenges the situation whereby men usually are culturally expected not to complain, because real men do not cry, real men do not feel pain, real men do not complain. That is very unfortunate, and I encourages us that we could be going through a deadly situation that can really drain our life out of us. So let's start the video by looking at this organ. And the prostate is usually an organ which is beneath the bladder. So this is the prostate, and this is the urinary bladder. This is the urinary bladder, and this is the pipe which urine leaves through from the bladder towards the outside. So when this prostate is affected by any of these two, it can block the urine from flowing. It can block the urine from flowing. Now, another picture showing us the prostate. So again, this is the urinary bladder, and then this is the prostate. So in this picture, it's showing us how the doctor can examine or assess this organ. Please, this is a very simple test that a doctor can do, and really have an impression of what is happening on the prostate. So if it is large, he will feel it more easily. If it is painful, he will feel it more easily. And if it is rough, then he can also advise. So this is a very important test, as we shall see in the upcoming images. Another picture. This prostate here has enlarged generally all over, all round itself, and blocked the passage of urine. So urine becomes so difficult to pass urine. And then again, this is another picture showing the same. This is the prostate, and if a doctor is to examine using a finger, it is easier to feel this from this side. Now, what is BPH and prostate cancer? So BPH is a non-cancerous, that's why it's called benign, non-cancerous enlargement of the prostate, affecting men from the age of 50 and above, or even from the age of 45. Also, the cancer affects men from the age of 50 and above. But now the cancer is it's a disease that can spread. It's a growth that can spread and leaves the prostate and goes to distant sites, and gives us a lot of complications. And the cancer usually develops, I've highlighted that in red, it develops quietly or silently, unlike BPH, because BPH presents quite early and we are able to come to hospital, or you will be able to have symptoms quite early. But for the cancer, it's usually very silent until it's very advanced. That's why we need to know how do we tell then that something could be happening. Statistics tells us that around 2,800 men are diagnosed with prostate cancer every year in Kenya, and around 1,300 of them will succumb to the disease. This is according to the National Cancer Institute of Kenya, and simply because they present when it is too late. This is very bad statistics. Half of patients that develop this disease will die from it, which is very, very unfortunate because they present when the illness is too quite advanced. What are the causes? Not known directly what the cause is directly, but some risk factors has been associated to developing this disease. Having an increased age, having an age over 50 years, like we've said, one becomes highly susceptible or easy to likely to develop this any of these two conditions. Also, if there's a family history, this is one of the cancers that we have a genetic predisposition. Genetic predisposition means if you are born by a man who has that, remember, one is always born from two parents. One is born from two parents. So you are halfway your father and halfway your mother. So if your father had genes that predisposed your father to developing prostate cancer, then you have half of those genes. Okay, so this is one of the cancers that is genetically implicated. Now, statistics have it that if a brother of yours has been diagnosed with prostate cancer, you also have 3 times chances of developing that. If your father has been diagnosed with it, then you have almost 2.5 times chances of developing that. So, and many other relationships to first degree relatives. First degree relatives are relatives that you share 50-50 percentage of DNAs. So it's not a curse. It's just like if your dad is dark, if your dad is chocolate color, if your dad's skin's color, you have your dad's skin color. The same case applies to the cells inside and the organs inside our body. Please, it's not a curse and it's not having had any sins whatsoever, but it's just an inheritance from what the cells or what genes the parents had. Okay, the parents had. Now, another risk factor is being from an African descent. Being from an African descent, global statistics show that the cancer is more and the prostate conditions are more in Africa. Now, other risk factors are lifestyle diseases. Lifestyle, not disease, but rather lifestyle. Obesity is a factor. Obesity is a factor. When you have more weight than your height can accommodate, or when your BMI, yeah, BMI, sorry, BMI is less or it should be less or equals to 25. So BMI, if it is more than this, then you need to be more cautious and more watchful for any of these two. Now, a high fat diet, like depicted on this picture, also predisposes us. Junk foods predisposes us to developing prostate cancer and benign prostatic hyperplasia. Smoking, smoking, smoking is a risk factor for any cancer in the body, and this is not an exception. So smoking also increases chances of developing one. Sedentary life. Sedentary life is a lifestyle where one is just seated, not exercising their muscles, and the prostate cancer is usually very close to pelvic floor muscles. That if we are not exercising, then the process tends to grow big and even can develop cancer. Now, so this is again what happens in benign prostatic hyperplasia. So the prostate is just uniformly large from all corners, and the urethra is blocked early because the enlargement develops uniformly all through the prostate. But now in the cancer, the tumor develops from somewhere very far from the urethra, very far from the urethra. And then the tumor can even progress and become bigger. The cancer can become bigger. Here it has started living out the prostate. It has left out the prostate and it is still probably not even blocking the urethra. That's why I said the symptoms are very silent for the cancer. Now, again, this is a picture that is depicting how the tumor grows, So for the cancer, the tumor will grow away from the urethra. This is very malicious of this tumor. It grows away from the urethra and will not therefore have symptoms. But the benign enlargement, the non-cancerous enlargement, will develop around the urethra and usually have symptoms quite early. Quite early. This is a normal one. This is a normal one. So What are the symptoms? So, like I said again, for the cancer, the symptoms are usually not there early in development. So, it's a very malicious situation that we have to know how to watch out for. Now, for the BPH and even late cancer, you can have frequent urination. Frequent urination. You urinate quite often, simply because you are not able to pass out all the urine, and then you still have a feeling of a full bladder because you're not able to pass out all the urine. Nocturia, this frequent urination usually happens at night. Many times you wake up more than 2 times, more than 3 times, many times to pass urine at night. So it's not a good sign. If that is happening to you, it's not a good sign. Another condition that can give us that is usually diabetes. We will look into it soon after this video. Now, maybe in the next video. Now, urgency is a feeling whereby, look at this one. Urgency is a feeling whereby you leak urine if you do not pass urine like immediately. If you feel like you want to pee and you don't have the opportunity to do that, you cannot hold urine anymore and you leak urine. It's called urgency. It's urgency. Now, post voiding dribbling. So you have finished passing urine, and as you think you are done, you get urine still passing out in drops, and that is what is happening here. Now, straining as you pass the urine, because if the prostate has narrowed the urethra, this is the prostate. If the prostate has narrowed the urethra, then it becomes difficult to push urine through. So occasionally you may have to use a bit of energy to push urine, and that causes straining to pass the urine, and you feel still incomplete emptying. You can also have an acute retention of urine. You can have a sudden retention of urine. We get patients at night. A man has not been able to pass urine at night, and then with the history, you realize they have had issues even with the frequency, with nocturia at some point, urgency, and then suddenly they cannot pass urine because the urethra has completely been blocked. Now, if it is cancer in advanced stages, it will give us back pain because it will go to the back. It will go to the bone at the back or some other organs behind the urinary bladder, and as we shall see. Now, how do we diagnose this? We diagnose this by one, a DRE. I said a DRE is the image we had at the beginning, a digital rectal examination by a qualified doctor. So the doctor will insert a finger through the anal opening and feel the prostate, which usually just lies in front of that rectum. They can feel it, if it is painful, feel if it is bigger than normal, feel if it is rough and the consistency, and then now have an impression that you will discuss with him. Now, a prostate surface antigen. God is very graceful enough and gave us this thing called a PSA. So a PSA is a protein that the prostate produces and puts into the blood. So at any point in time, the PSA should not exceed this range. So the normal range is 0 to 4. If it is BPH, the PSA will go high. If it is cancer, the PSA will go high. So this is what God had provided so that we are able to tell if the prostate is having any of these anomalies. A urine test can also be done to rule out any infection, because also if you have an infection, the PSA can go high. An infection can be just a urinary tract infection or a prostate infection. So you get infection that starts as a urine infection and then gets to the prostate, then you get what we call prostatitis. Now, if there's a mass in the prostate, then a biopsy must be done. A biopsy is usually getting a small piece of the prostate, very small, to send to a pathologist. A pathologist is a specialist who will look into it in a machine and tell us if it is cancerous or not cancerous. And then if it is cancerous, they tell us what grade it is. A grade is, if it is cancer, how aggressive it is, how quickly does it spread. Now, that is the confirmation of the cancer or not, or if it is non-cancerous, a biopsy. So whether you have a BPH, benign prostatic hyperplasia, or prostate cancer, the biopsy is what shall be used to distinguish the two. Now, after that, then an ultrasound is done, or usually an MRI, to now see the size of the tumor, the size of the growth, and how far it will have gone. Now, so stages are usually stage 1 to 4 as far as the tumor size is concerned. Can be stage 1, stage 2, stage 3 has already left the covering of the prostate. The covering of the prostate is usually just there, a small bag that covers the prostate, and then if it passes in there, it's called now stage 3. Beyond, when it start invading the next, the nearby organs like the urinary bladder, the rectum, then it is stage 4. Now, so an imaging like a CT scan or an MRI is used to tell us how far that has gone. Now, the grading I told you, a grading is seen from the biopsy that was sent to a pathologist. So this grading usually is just used to tell us how bad it is, how dangerous it is as far as aggressiveness. Is it a cancer that grows very fast, or in that case it is higher grade, or is it a cancer that grows very slowly? In that case, it's a lower grade. Now, how do we prevent? We cannot prevent this entirely because we do not know what causes it exactly. However, we have to know what are the risk factors, like exercising. If we do not exercise, we have a high chance of developing. If we use high fat diets, we have a high chance of developing. If we smoke, we have a high chance of developing. So we need to alter those risk factors, Now, what about if you have a family history? What about if you are at the age of 50? All those that are risk factors. Then we do what we call routine surveillance. Watch out by doing the PSA. By doing the PSA, every man should know what a PSA implies for his life, to save his life from prostate cancer. Now, if you have a family history, usually it's advised you do the PSA from 45 years and above. And then if you do your PSA at any time and it is, let's say, 0 to 4, if you have a PSA that is 2.5 and below, then we are usually not very worried and you can continue doing it after every 2 years. If it is more than that, between that and 4, then you will be advised to do it annually, every year. Now, what is the treatment? Treatment depends on the stage. For every cancer, for every growth in the body, it depends on how big it is. So if it is early stages, surgery is curative. You can have a surgery and completely cure it. If it is advanced, then now it's medications and radiation, chemotherapy and radiation. So for BPH specifically, we are not usually very aggressive to it, and the doctors can start by doing what we call a TURP, just trying to chop off a bit of it from inside the urethra so that the pipe becomes a bit bigger. Then now, if the obstruction still sets in again more frequently, and then let's say you have urine infections again more frequently, then the doctors might result in doing surgery. This is surgery to remove the entire prostate by laparoscopy, called total or radical prostatectomy, or the doctors can do an open one where the abdomen is opened, or the prostate can be accessed from that site, from that incision near the anus called the perineum. So to get off the prostate completely, and your life can still be normal without the prostate. Now, what about if it is cancerous? So if it is cancer usually in early stages, in stage 1, also we can still exercise active surveillance and monitor and watch out, especially if it is low grade. Imaging is done, PSA is done repeatedly to monitor if it is growing or if it is not growing, and most of the time it doesn't grow. But if it's found from stage 2, then usually surgery is advised, that you remove the prostate completely. So it's very manageable, and it should not take your life from you. Now, what are the complications? Like we said, acute urinary retention. You just get blocked completely one particular day, and it becomes an emergency on you. Chronic urinary retention, you have a bladder that becomes very big because you are progressively every other day you're not able to pass out all the urine. Now, bladder stones, bladder stones is the urine that are retaining inside the bladder. They form stones because They are salts that will tend to crystallize and form small stones if you are not completely emptying. Now, and usually kidney damage. So kidney damage, because if you are having a blockage from the urinary bladder, and then urine can go back to the kidney, yeah, urine can go back to the kidney, then this kidney shuts down. This kidney is just killed because the urine are going back to it, and it affects the functionality of that kidney. Now, for the cancer, like I said again, remember the symptoms don't set in very fast, and usually by the time you are having urinary symptoms, the cancer is quite advanced. The cancer is quite advanced, and this one will come even with back pain. It can be going along with, there are some nerves here, there are some nerves around, there are some nerves around. I've seen patients being managed for chronic hip pain, chronic thigh pain, or some joint pain, but they are just having a problem with the prostate malignancy that has grown, and it's affecting some nerves around there. Very unfortunate situations. Very unfortunate situations, and it's very unfortunate when we cannot just do a PSA regularly. So please have this done regularly, whether you're feeling anything or not. A PSA. Rule out that, because that is the biggest monster in the pelvis of men. That's the biggest monster in the pelvis of men. Now, so for the cancer again, I said you can get pain and then you can get anemia. Every cancer can give us anemia because your blood just goes very low, because cancer uses a lot of energy in the body. Now, I've said the backbone can be affected by this cancer. The backbone can be affected by this cancer, and as you see in this diagram, this diagram also shows us how, if this is blocked, then doctors will be trying to resolve this complication. The kidney has been obstructed completely, so usually they put in what you call a nephrostomy tube, a tube that goes directly to the kidney to try and get off the urine. Very expensive procedures, and very difficult life, poor quality of life to live with. So usually just have a PSA done to try and avoid all this complication. I'm giving you this so that you have insight of how bad the condition can be, the condition can be. Now, that is the backbone, that is the backbone, or the bones generally. So the cancer spreads to the backbone. The cancer spreads to the backbone, and all these ones are lesions or growths of the prostate cancer in the bone. This bone becomes very weak, and you find that patient suddenly just is not able to walk because the bone is broken. Very dangerous and a very difficult situation. Why? Because if we don't do PSS every year or every 2 years, as recommended by the doctor, then you have a challenge, you have a problem, because your cancer can grow and you don't have symptoms. Please, this is where the golden point starts from. I mean, this is where you should be able to pick the cancer. Please, this is where you should pick the cancer. Now, a DRE, have a doctor to look at the prostate, by inserting a finger through the anal opening and then examine the prostate. This can be prevented, this can be avoided if things are picked very early on time. And thank you so much, because that's all about the prostate, the two conditions affecting the prostate cancer and BPH. Next video will be on cardiovascular diseases, high blood pressure. We'll also look at diabetes in the subsequent video, and several more conditions as we move along. I really appreciate your following, so that we learn and get aware of these conditions and glorify God by just seeking healthcare on time, and we live a healthy life to glorify God. Thank you so much.